So when you're talking about the lower arm, you're going to go from the shoulder all the way to the arm, forearm, and hand. And just like remember, anytime you want to move something lower, you have to attach it higher. So if you want to be able to move the forearm, you have to attach higher by the scapula or the humerus. If you want to move the shoulder, you got to attach it to the scapula and the clavicle. So first off, we're going to talk about the muscles that hold that arm in place, your rotator cuff muscles. They're named off of the fossa. So this one was our subscapularis. This is anterior portion of my hand, so that's going to be my subscapularis with the subscapular fossa. The other ones are going to be on the back side. I'm going to take off the deltoid so you can see this. But if this is going to be my anterior side, this right here is going to be my supraspinatus and the supraspinous fossa. Infraspinatus, my infraspinous fossa. And then my teres minor going down on through here. So that's once again subscapularis, anterior side, supraspinatus, and the supraspinous fossa, infraspinatus, infraspinous fossa, and then my teres minor on the border of the scapula, all rushing together across this humerus head. So for the next activity with the arm, I want to kind of break it down and use the surface markers of the arm to kind of demonstrate the muscles on the model. So hopefully as I draw them on my arm, you'll make sense of what they look like as we look at the models on the upper limb. So first off, we're going to talk about the muscles that are going to move that arm. So remember, this is my arm, that is not my arm, this is my forearm, so this is my arm. So everything has to attach above and then attach itself onto the arm itself to move. So the biggest muscle you're going to see is going to be my deltoid. So the deltoid is going to be here, and you can see it on this model right here, big muscle on the lateral side. So it's going to be responsible for abducting my arm. Another muscle that's going to be important for moving my arm or flexing my arm is going to be my coracobrachialis. So coraco means coracoid process on your scapula. Brachial means your arm. So you're going to have a small muscle that's going to be coming from the middle of the arm and going up and then attaching itself onto my coracoid process. So that's my coracobrachialis. You can see that on this muscle over here. So I've taken off the deltoid, and that's what I'm seeing here on the 17. You're seeing this one coming down. It's attached to this coracoid process. Whereas this is my biceps. This is my coracobrachialis. If I take off the biceps head, you can see it over here as well. So deltoid, coracobrachialis. The other muscles I want to talk about are going to be moving that forearm. So either flexing that forearm or extending that forearm. So if they're going to be on the anterior side, they're going to be flexing the arm, flexing the forearm, and if on the back side, they're going to be extending that forearm. So the biggest one you're going to notice is going to be biceps brachii. Biceps brachia attaches to the radial tuberosity here. It has two heads. One's going to the glenoid tubercle, and the other one's going to go to the same place as that coracobrachialis, the coracoid process. So that's my biceps brachii. And that's going to be there, and you see that's going to be strengthened there as I flex. So that's going to be my biceps. Deep to that biceps, you're going to have the brachialis. So the brachialis is going to go down, and instead it's going to attach itself onto the ulna. So this is my brachialis. So if I'm looking at my model, this would be my biceps brachii. If I take the biceps brachii off, this is going to be my brachialis, and it's going to be attaching to the ulna down here. So here in blue, biceps brachii. Here would be my biceps brachii. I take off the biceps brachii, I'm looking at the brachialis. The other muscle we want to know that's going to be going down to flex the forearm is going to be the brachioradialis. So my brachioradialis is going down, and it's going to be on my radial side. So radialis on my radial side. It's going to go down, and it's going to attach itself onto the tip of that radius. And it's also going to allow me to extend or flex that forearm. Biceps radialis. And that's what you're seeing on this arm. This right here, going from the arm down to the radius, is going to be my biceps, my brachioradialis. So once again, deltoid, deltoid, coracobrachialis, coracobrachialis, biceps brachii, biceps brachii, brachialis, brachialis, biceps brachioradialis, brachioradialis. So it's going on the thumb, brachioradialis. Those are the muscles that flex the arm. Now we want to talk about the muscles that flex the forearm. So these are going to be on the back side of my arm. They're going to go down. They're going to attach themselves onto the olecranon process of the ulna. So when you extend that, that's going to be my triceps. So it attaches both to the scapula and to the humerus, and all itself attaches down onto the ulna for you to be able to extend that forearm. That's what you're looking at here with its 1, 2, 3 heads. And they're all attaching themselves onto that olecranon process on the ulna. Okay, so all that was the things on the arm that affected the forearm. Now let's talk about the muscles that's going to affect your fingers and wrist, both to flex your fingers, flex your wrist, or extend your fingers and extend your wrist. So the rule of thumb is that the muscles on that anterior compartment of your forearm are all going to be flexors. Flex my fingers, flex my wrist. And all the muscles on the posterior portion of your wrist or on your forearm are going to extend your fingers, extend your wrist. All the muscles that are going to be involved with the anterior forearm largely going to be flexors. There are some exceptions like a pronator muscles. But there are 3 compartments or 3 layers to the muscles of that forearm. In the first layer, you can put your fingers like that, and you can see there's 4 muscles that are going to be coming from this medial epicondyle by my pinky. And they're going to go down and they're going to attach to different portions superficially on the wrist and fingers. So the first one you're going to notice here is going to be my pronator teres. So the pronator teres goes down. And it's going to curve underneath that the brachioradialis to pronate your hand. It pulls the radius in the pronation fashion. The next muscle that's going to go down is going to be your flexor carpi radialis. So the flexor carpi radialis goes down and attaches itself onto the carpals and metacarpals on the radial side. So that's my flexor carpi radialis. Next one over, it's going to be my palmaris longus. The palmaris longus goes down. It attaches itself onto the palm to tense that fashion. The fourth and final muscle of that anterior portion is going to be the flexor carpi ulnaris. So the flexor carpi ulnaris goes down and attaches itself onto the carpals and onto the metacarpals on the ulnar side. So it's the exact opposite as the flexor carpi radialis on this side, then you have the flexor carpi ulnaris on that side. Let's look at the model to show you what they are. So, brachoradialis, pronator teres, flexor carpi radialis, palmaris longus, And then number 30, you have this, my flexor carpi ulnaris, right here. And that's what you're seeing on this and in blue and green. Now that was the superficial compartment, pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Now deep to that is going to be a second layer. These are going to flex your fingers, your digits. Remember when it says flexor digit, it means some digit, either a finger or a toe. And if it's a flexor digitorum superficialis, you know it's flexing the fingers, and it's the superficial muscle that does that. So this first one in the mediate layer is going to be your flexor carpi, flexor digitorum superficialis. So it's going to come down here from the medial epicondyle. It's going to go down through the carpal tunnel, and then it's going to go to the fingers to the middle digit, the middle phalanx. On the model, this is what you're seeing on this side. This is going to be my flexor digitorum superficialis, and that's going to be right here. Flexor digitorum superficialis. You can see the tendons running here. That these were the superficial tendons going down to the middle phalange of the hand. So these are those tendons. And then deep to that, what you're seeing here is going to be my flexor digitorum profundus. Flexor digitorum profundus goes down, it goes all the way to the tips of the fingers. So those are so between the superficialis and the profundus, these are going to allow your fingers to flex. So once again, flexor digitorum superficialis, these are the tendons. I take that off. These would be my flexor digitorum profundus, and those would be these tendons going down into here. I want to talk about is going to be on the back of the hand. So the muscles in the back hand are going to be responsible for extension of the wrist and extension of the fingers. So as your flexor carpi radialis and flexor carpi ulnaris flexed your wrist, there's going to be muscles that extend the wrist. The ones I really want you to think about are going to be the extensor carpi, extensor digitorum. So the extensor digitorum is going to go from the lateral epicondyle, around the same areas of brachoradialis. It's going to come down, and it's going to extend the fingers all along digits 2, 3, 4, and 5. And that's what you're seeing in this one. You're seeing this muscle going to all the different digits of the back of the hand. So 1, 2, 3, 4, all the tendons going down. See, these are all going to be your extensor digitorum. All right, I'm going to wash this up. Let's just do one last review. So again, here's my arm. Deltoid, rotator cuff muscles, subscapularis, teres minor, infraspinatus, supraspinatus. Muscles that act on the arm, you have the coracobrachialis, the choroid plexus, right there. Muscles that are going to act on the forearm, that's going to act here to flex or extend it. Big one here is going to be your biceps. And so it's going to be the two heads, one going to the glenoid cavity, the other one going to the coracoid process. You take that off. Brachialis here. Lastly, on this posterior side, you're going to see the brachoradialis go down and attach itself to the end of the tip of the radius. Okay. Muscles that are going to be in the anterior forearm, you're going to have the pronator teres. So these are my muscles. Pronator teres, flexor carpi radialis, palmaris longus to the palm, flexor carpi ulnaris. On the deep compartment, it's the medial compartment. You have the flexor digitorum superficialis, the back side being the inside of that. Don't worry so much for identification because it's harder to see. But what you will be able to see here is your flexor digitorum profundus. On the back side, the one that's going to extend that forearm is going to be the triceps. 1, 2, 3 heads, all going down to the olecranon process. And then the ones that are going to extend the fingers and wrist, you're going to have this one's going to be my extensor digitorum. Okay. So as a final review, deltoid, going to abduct the arm. Take that off, we'll look at the rotator cuff muscles. Subscapularis. Turn on the back side. Teres minor. Infraspinatus, supraspinatus. Muscles that are going to act on the arm, you have the coracobrachialis, which is going to be coming from the arm, going up to the coracoid process. Muscles that are going to act on the forearm, this. First off, you're going to have the biceps brachii. Take the biceps brachii off. Brachialis. The other one that's going to flex the forearm is going to be this, the brachoradialis, going from the arm, going down, and then attaching itself onto the tip of the radius. Muscles that are going to extend that forearm are going to be your triceps, so 1, 2, 3 heads. Are going to come down across the tendon and attach themselves onto the olecranon process on the ulna. Muscles that are going to flex the fingers and wrist are going to be coming from the medial epicondyle. So first off, we have the pronator teres. Take off the brachoradialis, you'll see the pronator teres going to the middle part of the radius so that you can pronate your arm. Going from there, we're seeing the flexor carpi radialis going down to the radial carpals and the radial metacarpals. You're seeing the palmaris longus going to the palm, and the flexor carpi ulnaris here. So that's going to allow you to flex or adduct your hand. If you take out this compartment, you're going to notice the flexor carpi superficialis on the undernight in the middle compartment. notice the only way you're going to see it on this model is to take it off, but you're seeing the tendons there. If you take that off deep, you're seeing the flexor digitorum profundus, the deeper one that's going to attach itself onto the fingers from there. On the back side of the hand, the fingers that are going to extend, the muscle is going to extend those fingers, is going to be coming from the lateral epicondyle. It's going to go down, give tendons 2 digits, 2, 3, 4, and 5 to extend those. Both your upper limb and your lower limb, when you're talking about actions like flexion, extension, where if you want to have a movement of a limb, you have to have muscle attachments on the bones above the joint. Like for example, if I want to move my thigh and flex it or extend it, my muscles have to be attached to the hip so that it can move that thigh, either flexing it or extending it. Same thing with your leg. If you need to be moving your leg either to extend it or flex it, those muscles have to be attached up on the femur so that you can move that. If the muscle attachments are below the joint, you can't have movement. For example, the muscles of your shin do not move your knee because they are attached below that joint. So when you're talking about your leg, first thing you're going to notice here on the above portion, this is going to be your iliac psoas major. Psoas major here, iliacus here. They merge together to attach themselves on the femur. So these muscles, when they contract on the femur, they're going to flex that thigh. On the other side, if you're talking about the posterior portion of your muscle, your upper limb, this is going to be your gluteus muscles. So right here, this is going to be my gluteus maximus that allows me to step off or extend that thigh. So it's the opposite of the iliac psoas. But your thigh also does other actions. It can also abduct, as if you're scissor kicking. And that's also by the gluteus muscles. Well, these are going to be from your gluteus medius and minimus. So if I take off the gluteus maximus and remove this tensor fasciae lata, this would be my gluteus medius and gluteus minimus. And these muscles are going to abduct that thigh. When you get to the actual thigh and talking about moving the leg, there are certain compartments of your leg. So you have an anterior compartment, a middle compartment, and a posterior compartment. The anterior compartment is mainly going to be with extending that leg. Medial compartment is to be the groin muscles that allow you to move your feet inward. And then your hamstrings on your back side, your posterior compartment, are going to allow you to flex your leg. So let's look at those muscles one at a time. So the first muscle we're seeing here across the tip of that lower limb is going to be your sartorius. It attaches all the way from the ilium bone, crosses the thigh, and attaches itself on the tibia. So it's also going to flex the leg as well as it flex the thigh. So it's going to go down there and it's going to have actions both on the thigh and on the leg. Remove the sartorius. Now we're going to look at the quadriceps. Remember, quad means 4. So your quadriceps have 4 muscles. The biggest one right down the center is your rectus femoris. It attaches all the way from the ilium and goes down like all the quadriceps muscles. They attach at the patellar tendon here as they're going to that patella. So rectus femoris. You take off the rectus femoris and you're going to see 3 muscles. One lateral, one middle, one medial, one middle, one lateral. So these are the vastus muscles. The one next to the big toe, so that's medial, my vastus medialis. The one deep to that rectus femoris is going to be my vastus intermedius. And then lastly, by the little toe, you're seeing the vastus lateralis. So rectus femoris, vastus medialis, intermedius, lateralis. Those are the main muscles from the anterior compartment. Now we want to talk about the muscles of the middle compartment. So this muscle right here, this long, slender muscle, that's going to be your, like a seam or an inseam kind of. So if you're getting your pants measured, you're getting custom suit, they're going to measure your inseam going from the groin down to the bottom of the leg. So this is your gracilis. It helps adduct your thigh. If you remove the gracilis, then you're going to see the adductor muscles, the adductor longus, brevis, and magnus. The biggest one we're seeing here is the magnus, big and strong. This muscle over here is your adductor longus. Remove that. And this one would be your adductor brevis. So once again, magnus, longus, brevis. All of them together cause this action when you are adducting your thigh. Then lastly, in your posterior compartment here, you have the hamstrings. There are three muscles that are going to move to flex your leg. They're coming up, all of them, from the ischiotuberosity on the pelvis, and then they're going to go here. So they're going to split at the popliteal fossa at the knee. One is going to go over, two are going to go medially by the big toe. One is going to go laterally by the little toe. So this is going to be your biceps femoris, semitendinosus, semimembranosus. So boys to men is the terminology, going from lateral to medial. Biceps femoris, semitendinosus, semimembranosus. Boys to men. Biceps has two parts to it. Don't worry about the different heads to it. But this one would be the deep head. This one would be your long head. That's my biceps femoris. Then here is going to be my semitendinosus and membranosus. So one thing you're going to notice here, the tendinosus has a very long, narrow tendon, and it's going to go to that medial side of the foot. So it's going to be my semitendinosus, known by the tendon. On the border, right deep to that, is going to be my membranosus on either side of this. If I tear off the muscle, you can see it a lot better. Semitendinosus, semimembranosus. Now your anterior portion of your leg is going to be mainly involved with dorsiflexion, moving your feet upward, and then extension of those toes, extending them upward. There's not a lot of bone structures on your shin. That's why it feels like, that's why it hurts, or you can have shin splints because there's no muscles there. But when you are talking about your muscles, the big muscle here going from the top of the tibia, curving its way down, and you want to follow the tendons when it comes to these ones. This is my tibialis anterior. It goes down and it goes medially across to the bottom side of the foot to attach that toe there. So it's mainly involved with dorsiflexion. The rest of the toes are going to be given action by the extensor hallucis longus. And you can see, if you, when in doubt, you follow the tendons. So this tendon goes from the big toe, follows, and is involved with this muscle right here. And you're following the tendon. That goes to your big toe. So that's my extensor hallucis longus. Curls the turf upward. The last one would be your digits. So this one would be 1, 2, 3, 4, your other lateral 4 digits. So they're all going to go over here, and these are going to be your extensor digitorum longus. So that's the difference between the toes and the fingers. You have extensor digitorum in your fingers that's going to allow your fingers to extend, but you also have the extensor hallucis, extensor digitorum longus to move your toes upward. So we talked about the anterior compartment. Now let's talk about the lateral compartment. So that's little toe, lateral malleolus, fibula. So just like you have a fibula making up your lateral bone of your leg, you also have the fibularis longus curving down and going around to the bottom side of the foot, and the fibularis brevis going down here and attaching themselves along with the foot as well. So that's going to allow you to evert your foot, as in this action. You feel that tension on that lateral part of your ankle when you do that action. So that's your lateral compartment. Fibularis longus, fibularis brevis. Lastly, we want to talk about the posterior compartment of the leg. So the first off is going to be your calf muscle, and there's a couple muscles that are going to be making up this long tendon, this calcaneal tendon, going from the calf down to the calcaneus so that you can plantar flex your foot. The first one, the more superficial, is going to have a funky name. It's going to be the gastrocnemius, the gastrocnemius. It's the most superficial one. It goes down and it splits and attaches itself to the femur there. You take that off, and then you're going to have the soleus deep to that. And both those together make up the calcaneal tendon. So once again, gastrocnemius, soleus. If you take that off, there's going to be three muscles that make up the flexor portion of your foot. So the extensors were on the anterior side. Now your flexors are going to be underneath at the bottom part of your foot to allow you to curl your toes and flex them in, both your big toe and your little toes. You really can't see them very well on the model, so I won't have you identify them, but just know that you have the three muscles of the deep compartment of the posterior side. You have the flexor hallucis longus, same as you had an extensor hallucis longus on your anterior side. You have a flexor underneath. You have a tibialis posterior, which is going to curve around and allow you to invert your foot. And then a flexor digitorum longus, which is going to go down and attach itself onto the bottom part of the toes so that you can curl your toes inward.